Hi, my name is Jenna Jensitz, and this is my personal research project and presentation. The person I will focus on for my research is my 91-year-old grandmother. She suffers from peripheral neuropathy, a condition that weakens muscle control and takes away the ability to walk. She is almost totally confined to a wheelchair, and her ability to do things she once enjoyed, like putting together a puzzle or playing a game of Sudoku, and even signing her name to a greeting card, have all diminished tremendously. Up until recently, she would always look forward to going to the dining area in her assisted living facility. She would meet with her friends and have meals with them, or go outside and sit in the common area garden and exchange stories with her friends. Her cognitive awareness, however, remains sharp, and she recalls and remembers many past events. Now she spends most of her time in her apartment with visits from the staff and caregivers, and her granddaughter visits her often. Because I live so far away, I do not have the opportunity to visit her as much as I would like to. I feel as of lately, with the setback she has had on her social and emotional wellness, all have suffered tremendously, and her physical wellness is now defined by her supportive care. This illness has challenged my grandmother's wellness tremendously. I would now characterize her illness as being in the most severe stage. Different symptoms are popping up every day, presenting major challenges in her quality of life, with the most crippling one being her mobility. From a nursing discipline, peripheral neuropathy refers to the many conditions that involve the damage to the nervous system, the brain, and the spinal cord, which make up the central nervous system, communicate with every other part of the body through the peripheral nervous system, a huge and very important network of the body. With age comes progression of this illness, and sadly it has progressed over the last 10 years in my grandmother. She takes medication on a daily basis in hopes of minimizing some of her symptoms. Sadly, she is currently in the 4th stage of her illness. At this last stage, there is a loss of sensation, and the most dangerous stage, with complete numbness in your hands and feet. From a gerontology discipline, reduced mobility or balance problems are symptoms of this illness. It causes numbness or tingling in the hands and feet, muscle weaknesses, and loss of coordination and balance, increasing fall risk. These symptoms make walking difficult and increase the risk of falls and instability in older adults. Up until recently, she was considered at high risk for falls, but now she has completely lost strength and coordination in her legs and can no longer stand or walk without assistance. Relying on a wheelchair, she sometimes manages to escape this illness with pleasure strolls in the garden of the retirement home. From a psychological discipline, depression is a common symptom of this illness. Managing and coping with it leaves you with feelings of depression and anxiety because of her daily struggles with mobility issues. She rarely socializes anymore with her friends in the dining hall of her retirement home, and often decides to eat dinner alone. Depression is affecting her everyday life. From a human service perspective, one study details how painful peripheral neuropathy is and the quality of life that it comes with. The study examines how painful peripheral neuropathy affects a person's quality of life. People with this illness consistently experience significant reductions in physical, emotional, and social well-being. This illness significantly lowers an overall quality of life, especially in physical functioning, and daily independence. Leisure research. Evidence from the research shows that different types of healthy leisure can help improve her wellness and quality of life. Healthy leisure activities focus on physical exercise, comfort, mental stimulation, and emotional well-being are very important at this stage. Low-impact exercises could help with physical comfort and help maintain her strength. Listening to music and nature sounds could calm her. Just sitting and talking about past activities and memories could prove stimulating for her. Self-initiated exercises and leisure type intervention used by individuals with this illness can improve the quality of life. Research has found that focusing on promoting health through leisure is effective. Physical exercise focuses on your mood, anxiety, and depression. Studies have found that with an exercise program focusing on daily stretching, endurance, and balance exercises is safe for individuals with this illness. Exercise can help improve balance, strength, mobility, confidence, and reduce fear of falling and endurance. And in another study, managing stress and emotion well-being is valid in the elderly suffering from peripheral neuropathy. Relaxation techniques such as deep breathing, meditation, and mindfulness can help manage stress and pain. Social engagements can boost morale, and adequate sleep can help reduce the symptoms of neuropathy. For my next slide, recommendations to help my grandmother, I have designed a personal leisure plan that consists of relaxation while doing the different exercises. Encourage relaxation by having soft music playing in the background to improve the blood flow in her legs. Each day, do seated marching and seated leg extensions along with ankle circle exercises. Cognitive stimulation each day. Have a caregiver or family member look through old pictures with her and stimulate her by asking questions. Plenty of rest. 2 or 3 times per day, have her take adequate rest for an hour or so. Social stimulation. 2 or 3 times per week, have different family members call for short periods of time to stimulate her and show her that we still care about her. Send her cards or funny jokes by mail. Comfort therapy. Each week, have a caregiver or family member give her gentle massages and wrap her in warm blankets. Next is constraints, and with my grandma's constraints, a big one I see is the limitations in her memory, in her day-to-day, just trying to use silverware or hang clothes up on a hanger. But strategies at this stage relate to encouragement and the visits from her family to continue her doing her physical treatments and strengthening exercises that will help regain her memory and just the familiarness with her early on life. In conclusion, my grandmother's illness has limited her physical, but it has not diminished her mental capacity and strength. She still has the ability to engage emotionally and mentally, and that strength alone keeps her going. Despite all the challenges she faces, we must continue to reassure her and motivate her to a quality of life that she is happy with. We keep spending time with her, paying close attention to what needs, what shares and remembers, and laughing and joking with her. We feel hopeful and reassured about her happiness and well-being because the family bond we have through her memories.